While in early childhood the pelvic rotator cuff muscles strengthen to develop optimal dynamic back stability, proper walking, and bladder and bowel function, as a person ages, the pelvic rotator cuff and other support structures of the internal organs change in structure and function. The tissues thin, decrease in collagen content, increase in filler tissue, and decrease in contractile fibers. In a healthy 25-year-old woman, the pelvic diaphragm can be compared to 5 sheets of tissue paper. In a 65-year-old woman, it is more comparable to 1 to 2 sheets of tissue paper that are crumpled and have holes poked through them. The tissue in a 25-year-old is pinkish in color with muscle cells interspersed with connective tissue cells. By 65 years of age, there is more connective tissue and fewer muscle cells, resulting in a lighter pink to whitish appearance of the pelvic diaphragm. Hypoestrogenation after menopause leads to decreased blood supply to the pelvic muscles, decreased speed of nerve transmission, and decreased muscle contractile strength. Hypoestrogenation also leads to decreased collagen content, which is the main supportive protein in muscle and connective tissue. The collagen becomes meshed in form and less is newly synthesized. Thus, it becomes less mobile, is slower to respond to stretch, and tensile support is compromised. With age, thinning and descent of the pelvic diaphragm and fascial supportive structures cause a general descent of the bladder, bowel, and uterus. Because the pelvic diaphragm connects with the sacrum, this descended position can affect sacroiliac and lumbosacral joint position and function and can be a factor in back pain, hip and leg pain, and foot dysfunctions. These physiological changes in the pelvic rotator cuff affect standing balance and can be a factor in falls and walking efficiently. Changes in the pelvic rotator cuff can lead to a loss of bladder and bowel control.